Hi guys, this is Medicine Jerk and today's topic is amoebic liver abscess. Amoebic liver abscess. As the name itself specifies, this is because of amoeba. Because of amoeba which causes abscess within the liver. And what amoeba? I think everybody knows it. That is Amoeba histolytica. Okay, and actually what type of parasite is it? A parasite? What type of organism it is? Actually it is an protozoan. It is an protozoan, and this Amoeba histolytica causes a dysentery. It causes a dysentery, which is also termed as amoebic dysentery. And this amoebic dysentery is one of the most common type of dysenteries in India. And this amoebic dysentery occurs in the patients of younger age group. With low socio-economic status. How actually it spreads? It spreads via fecal-oral route. It's mainly because of foods which are infected with the quadrinucleate cyst. It's mainly because of ingestion of foods with quadrinucleate cyst. That means we can tell that quadrinucleate cyst are the infective forms of the amoebiasis or the Amoeba histolytica. So we can term quadrinucleate cyst as the infective forms. So it actually enters into the GIT after excitation. That means cyst will open out and all will form trophocytes, and these trophocytes are nothing but the feeding stages of Amoeba histolytica. These are the feeding stages of Amoeba histolytica. And now these feeding stages are nothing but they are feeding. The name itself specifies that these are the feeding stage. That means it starts to feed on the intestinal walls, so which leads to formation of ulcers. And peculiarly these ulcers are in a flask shaped. So these are termed as flask shaped ulcers. If these ulcers are very deep, then blood may also come out within the stools. So bleed will be positive. And if the patient's immunity is very much low, then the Amoeba histolytica digs deeply into those ulcers. It may dig into the ulcers and it may enter into the blood circulation. That is superior mesenteric vein. And you just see, I'm just drawing a liver. And this is the portal vein. And this portal vein is formed by the joining of two major veins. It is formed by joining of the two major veins. One is the splenic vein, in which inferior mesenteric vein will be opened up, and other one is a superior mesenteric vein. And the organisms or the trophozoitic stages will enter into the superior mesenteric vein, and via the portal circulation it enters into the liver cells or the hepatocytes, and it will cause the lysis of the hepatocytes or the liver cells. So it forms the abscess over here, which is nothing but the amoebic liver abscess. It forms a pus over here, which is of color of anchovy sauce. So this can be called as anchovy sauce pus. So anchovy sauce pus, and this is nothing but amoebic liver abscess. So this is nothing but amoebic liver abscess, and this is also termed as extra-intestinal amoebiasis. This can also be termed as extra-intestinal amoebiasis. This is extra-intestinal amoebiasis. So now we should see one of the most important aspects, that is symptoms. So let's see what are the symptoms. will be present in the patients of amoebic liver abscess. Okay, so the symptoms are basically can be remembered by a mnemonic called as AFFA. ठीक है ना, AFFA, AFFA. ठीक है ना. So first A will be abdominal pain. First A will be abdominal pain, and the F will be fever, and the next F is nothing but the fatigue, and the last A is anorexia, and the last A is anorexia. Okay, out of all these 4 symptoms, abdominal pain is the most common symptom seen in the patients of amoebic liver abscess. Seen in the patients of amoebic liver abscess. So what is the investigation of choice? Here the investigation of choice will be serology. So what is serology? Serology is nothing but the detection of the antibodies. So here also we will detect the antibodies. Those antibodies are nothing but IgG antibodies against Entamoeba histolytica. IgG antibodies against Entamoeba histolytica. Okay. So what are the other investigations which can be done? There are a lot of investigation. One more most important investigation is USG, and CBP can all be done, and LFT can also be done in this type of patients. So now comes to the important part of the topic, that is treatment. So treatment is divided into 2 parts. One is the conservative part and another one is surgical or the aspiration part. First one is the conservative management. Here we can give the high doses of metronidazole via oral route. High doses of the metronidazole via oral route, which is of about 750 mg. Which is of about 750 mg TID for about 10 to 14 days. For about 10 to 14 days. And the patient generally becomes asymptomatic within 3 to 5 days. Patient generally becomes asymptomatic within 3 to 5 days. Okay, 3 to 5 days. If the patient is still symptomatic, even after giving the high doses of the metronidazole, or large-sized amoebic liver abscess, then the treatment will be changed. That is aspiration of the abscess should be done. That is nothing but aspiration of the abscess should be done. So this is amoebic liver abscess. So one of the important topic for the NEET PG. Thank you. Signing off, Medicine Chuck.